Hey, everybody, welcome to another episode of the podcast. And I'm so excited today because we have a very special guest. And before we get into our special guest, I just want to tell everybody that this podcast is going to be for anyone who is expecting. So if you are expecting, you know someone who is expecting, definitely share this episode with them. We are going to get into the benefits of chiropractic care, and we're going to talk about how chiropractors can benefit you if you are expecting, all the way through the postpartum period, and even a little bit into how chiropractors can support your newborn baby. So if that's something that you want more info on, and believe me, you do, then stick around. So our special guest today is Dr. Chelsea Warnecke. She is local to me here in Cleveland, Ohio, and she is a phenomenal chiropractor who actually saw my daughter. And it was such a gentle and such an incredible adjustment that I had to have her on the podcast so we can talk about the benefits of chiropractic care from pregnancy all the way through the postpartum period. So, welcome and thank you so much for joining us.
Yeah, thanks for having me. I'm excited to be here and to be doing the podcast.
Yeah, me too. So, why don't you introduce yourself? Tell everybody whatever you want to about you, your background, and how you got into chiropractic medicine.
Yeah. Okay. So I grew up in Northwest Ohio. I was very involved in athletics and everything when I was in high school and growing up. And then I actually started seeing a chiropractor because I had some low back pain. I think part of it was due to playing basketball and soccer year round, running on uneven soccer fields and pounding on the basketball court. So then I started seeing a chiropractor. I was able to stay involved in my sports, avoid injuries, and never really had to miss any practices or games, which is awesome. As a young athlete, that's always important. So then, when we had opportunities to do some career shadowing, I shadowed my chiropractor. I saw how much she loved her job. She got to work with a wide variety of patients from young kids to elderly adults, which I also thought was cool, and taking a more conservative and preventative approach to healthcare as opposed to more traditional medicine. So then I went to Wright State University and got my bachelor's degree in biology with a concentration in exercise science. And then I moved to St. Louis to attend Logan College of Chiropractic and got my doctorate there. So also met my husband there, which brings me to Northeast Ohio. So just crossing to the other side of the state. So I've been practicing in the Akron-Fairlawn area now for about 6 years.
That's incredible. So you have a long, long relationship with chiropractic care, and it made a big difference in your life, even all the way as a high school athlete, which is incredible. So let's talk about like some of the different demographics that you guys help in chiropractic medicine. Like, what is going on? Why does everybody recommend all pregnant people to go to a chiropractor and find a chiropractor as soon as possible? Like, what are the benefits and why is that so important?
Yeah, so you can really, I've treated my niece when she was within like the first week of her being born. I think she was maybe like 5 days old when I first adjusted her. So you can really treat infants all the way, like I said, to elderly adults. And it's more for low back pain, headaches, migraines, sports injuries. So we can treat the entire body. A lot of times people think of like neck and back pain, but you can also treat wrists, shoulders, hips, knees, ankles. And then when we're talking about like prenatal care, care during pregnancy, it's a great option because we're not using drugs. So we can help manage pain, we can help manage migraines, and you don't have to worry about, taking Tylenol, ibuprofen, over-the-counter medications. Maybe you were on medications that your healthcare provider wants you to no longer take because maybe there's some contraindications with taking that while being pregnant. So we're able to help you manage any pain or those symptoms, again, without medicine. So it's a good, safe alternative, especially during pregnancy when there's some, you know, medications and things you want to avoid.
Yeah, and let's talk about labor too, because I have heard that getting chiropractic care can really help to make sure that your pelvis is open and that allows your body and your baby to be in optimal position for labor, which could help shorten the length of your labor. So, is that true? And what are some other benefits that chiropractic care can have on labor?
Yeah, absolutely. There's some studies and research that has shown that it can decrease the length of labor, decrease pain. And what we're trying to do while a woman is pregnant and during her pregnancy is keep the pelvis relaxed and balanced and moving properly. So that way, again, like you had mentioned, as your body changes, your pelvis is properly moving, there's no restrictions, and that just speeds along that labor and delivery process, kind of leads to fewer complications with that. And then we also, some chiropractors are trained in Webster technique, which is, again, another buzzword that you hear a lot, whether you're talking about chiropractic or maybe talking to like your midwife, your doula, your OBGYN, they may mention it. So what you do with Webster technique is you're releasing tension on the round ligament, which goes from the uterus to the pelvic bone, the abdominal muscles. So you're releasing that tension, which again, just helps keep everything relaxed and moving process to make labor and delivery a little bit smoother.
Yeah, actually, let's talk a little bit about that. So, if people do want to look into chiropractic care, one, like, could we assume that all chiropractors are Webster trained and certified? And if not, like, how do we go about finding those specialty for physicians?
Yeah. So it's not a technique that you learn in chiropractic school. It's an elective that you can take. There's outside continuing education courses that you can take to get trained and certified in Webster technique. So a lot of times if you're Googling and searching for providers in your areas, they may list on their website that they're Webster technique trained, they're Webster technique certified. There's a chiropractic group called the ICPA, which is the International Chiropractic Association. I'm missing one of the letters in there. But anyways, that's a group that they do a lot of training and advanced coursework with treating women prenatal, postpartum, treating babies and infants. So then you would know that they're certified and knowledgeable with Webster technique.
Okay, fantastic. And then to see a chiropractor, do we have to go to our OB and or our midwife in order to get a referral, or is that something that's like covered by insurance? Like, how does that part of it work out?
Yeah, so we're considered primary care providers. We're a specialty, but you can just walk in off the street. You don't need a referral from a midwife or from your OBGYN. Most insurance most insurance companies do cover it. So unless if, like, for example, my dad works for GM and they have an Anthem Blue Cross Blue Shield policy that excludes chiropractic. And that's just because to keep the cost down for the company for that health insurance. So you should always go through your benefits to see if your employer chose a policy that excludes chiropractic care. But for the most part, nowadays, every insurance company covers chiropractic. Sometimes they may have a limit on how many visits you're allowed, but there is at least some coverage. And then for our office in particular, we do have cash rates. So maybe you have a super high deductible and you don't want to go through your insurance, or if you happen to have a healthcare policy that excludes it per the employer for whatever other reason, then you can still be seen.
Love it. So we definitely have options that would make it affordable and we can find our own chiropractor without a referral. So that's awesome to know. Okay. So then let's talk a little bit about what can happen when we have our brand new baby, right? So we've come home and we're thinking about how chiropractic care could benefit a newborn. So, what are some of the things that you commonly see going on with some of your littlest patients, and how does chiropractic care benefit them and help to turn those things around?
Yeah, so a lot of times parents will bring their newborns in. Maybe they're 2 to 4 months old. They're having problems latching, feeding, constipation, colic. Again, like if they're having problems falling asleep, staying asleep, getting on that nap and sleep schedule, we'll get them adjusted. So a lot of times with infants, if you think about the birthing process, it can be traumatic, especially depending on all of the specifics, whether it's a vaginal delivery, a C-section, if force or forceps were used to help the baby exit the vaginal canal. All of those things can play a part in that. So what we then do is find any areas that might be restricted. And like you saw with your daughter, it's very gentle, light pressure. So it just helps the nervous system function optimally. So again, they sleep better, they're having better bowel movements, they're breastfeeding better, or even bottle feeding better too. So it just helps make for a healthy, happier baby.
Love that. And yeah, it was so gentle and so beautiful to watch my daughter be adjusted. I do know though from seeing like YouTube videos and then also from being adjusted myself as an adult, it's a lot louder when adults are adjusted. And sometimes people may think that that sound equals like pain or discomfort. So what do you have to say about like the loud popping and cracking sounds that you hear when people are being adjusted when they are over the hill and a little bit older than our little babies?
Yeah, so the fun fancy term for that is called cavitation. So it's just when gas is released from that joint capsule. So our joints are lined and covered in fluid. So you put pressure on that joint and then apply that force, and that allows or causes that gas to be released from like those little bubbles, and that's the noise. So it's nothing breaking, it's not painful. It may be startling the first time you get adjusted if you're not quite expecting it or not sure what to expect, but it's typically not painful.
And I've been getting adjusted for like a few months now, actually, like several times a week. And that sound happens all the time. And I have to say, it's not painful at all. And I actually feel a whole lot better, like going through chiropractic care than I did previously. A lot of like the tension and like my back and my neck has been relieved. And so it's been fantastic to be a part of chiropractic care because no one else could really relieve it or figure out what was going on. And I don't have to take medication for it, like you said, because I don't like taking medication. Personally, I always want to find a natural remedy wherever I can. And so it was awesome to be able to get that. Do you find that there are certain like supplements or things like that that you guys recommend that people can take in order to promote like stronger bones and joints and health overall?
Yeah, so depending specifically on where the patient is at as far as their health, their diet, what kind of symptoms and things that they're dealing with, sometimes I'll recommend turmeric is great for just reducing overall inflammation. So if somebody's dealing with more chronic inflammation type symptoms, that's always a good one that I go to. Standard Process is a supplement company that makes a really good glucosamine supplement. So again, depending on the condition and what's going on, I may recommend it just for basic joint health. Sometimes I'll dose it out like a steroid dose pack if somebody has a really acute disc injury, and that's actually worked really well for a handful of patients. Magnesium is another really good go-to as far as like any muscle cramps or like a feeling of muscle fatigue. And if people are having issues falling asleep, I love going to magnesium over melatonin, especially when the issue is having trouble falling asleep. So those are typically like my three go-to ones outside of vitamin D, a good multivitamin, and then a good omega fish oil supplement. Especially during pregnancy, you want to make sure you're getting an adequate amount of DHA.
Yeah, love that. And let me ask you this too. Sometimes when people do have epidurals, like during labor, they will have like back pain, and they say that the back pain continues even well beyond like the actual labor process. So, is that something that people can come to chiropractic care for? And is that something that can be looked at, or is that something that will be better served elsewhere? And if so, where?
Yeah, so we do see that commonly after having an epidural, there's still some sensitivity to the area. So sometimes the adjustments help because you're getting better nerve communication between the skin and the muscles in that area of the low back. It can also relieve some of that dural tension by doing some muscle release, especially through the upper cervical spine. So it may take some time for that to completely resolve, especially when you're talking about healing nerves. But yeah, it's definitely something that could potentially help.
Okay, love that. And do you have other tips for people that may be expecting on like ways in which they can like strengthen their core and really have like a beautiful, like balanced and physically optimal pregnancy, like throughout one trimester one all the way through three?
Yeah, so I would say it would be especially important if you're trying to conceive or you're thinking maybe in like the next year or two, you want to start trying to have kids. If you're not already physically active, I would probably start some kind of regular exercise program, whether it's like Zumba, Pilates, yoga, walking, running, whatever type of exercise you think you might enjoy, because I think that's the most like limiting factor when it comes to exercising regularly is not enjoying it. So find something that you enjoy as vigorous or as light as you would like. So again, anywhere from like yoga to CrossFit. So starting that off before you become pregnant, then you can kind of continue with where you're at. A lot of times, if you're not really active before pregnancy, definitely talk with your doula, your midwife, your OBGYN, your chiropractor, see where you're at and what kind of activity would be safe for you. So a lot of times, if you're not very active before you can become pregnant, you can still, go out for a walk, do some light, vigorous activity. Yoga is always great, even prenatal and during pregnancy and postpartum as well. So it's all about kind of trying to get into some healthy habits when you're trying to conceive, and then continuing on during your pregnancy, again, depending on your symptoms, how you're feeling, kind of just got to listen to your body. But definitely just staying physically active makes everything better.
Yeah, love that. Those were some fantastic tips. Did you have any other tips or words of wisdom or any other information that you want to share with anyone about chiropractic care throughout your life and also throughout the fourth trimester with your family?
Yeah. So I think it's great to be adjusted. Again, if you're a kid and you're dealing with your infant, your toddler who's, maybe having some digestive issues, isn't sleeping well, is having some troubles like concentrating, paying attention. A lot of times people think chiropractic neck and back pain. And like I had said, it's a lot more than that. And two, when you're trying to conceive while you're pregnant, the adjustments can help. Again, it's going to help your nervous system function optimally. It's going to help reduce pain. It's going to help keep that pelvis nice and relaxed and moving properly. And again, depending on what your goals are for your labor, delivery, and for during your pregnancy, that can impact those in different ways. So if you're really trying for a more natural delivery, if you want to go for a home birth, I would definitely recommend seeing like a qualified chiropractor in your area. And postpartum too, again, as the ligaments start to stiffen back up and your body, goes back to normal per se. It's good to, again, just to be adjusted, just get a once over, make sure everything's moving properly. And two, to see, what kind of pelvic floor strengthening exercises, that's especially important postpartum, and even while you're pregnant, that'll help with labor and delivery as well. So whether that's a chiropractor or a certified pelvic floor specialist like physical therapist would be great too postpartum. I would definitely recommend doing that.
Love, love, love those tips. Those were fantastic. Okay, so let's talk about where people can find you. So if people are in the Cleveland, Ohio area and they are like around Akron and Fairlawn and they're looking for a physical therapy as well as like chiropractic care, and that's something that they want to come in for in person, like how can they reach you? How can they get a hold of you? And then we already kind of gave a website for people that are not in Ohio. So we'll drop that in the description for everybody that may be in other states and don't have any access to the fabulous care of Dr. Warnecke. No worries. We'll definitely make sure that we get you a directory so you can find someone locally.
Yeah, so if you need to schedule an appointment and you're local to the Akron, Cleveland area, the office number is 330-800-9009. You can also schedule via our website, which is akronfairlandchiropractor.com. You can find us on Instagram and Facebook at Fairlawn Family Chiropractic. And I think we even have a TikTok page. My husband handles all of that, but so you can find us on TikTok too.
Okay, awesome. I will drop all those connection links in the description so you guys don't have to worry, including the phone number in case you didn't get a chance to write it down. And I just want to thank Dr. Warnecke so much for joining us and for dropping so many gems about chiropractic care and how we can use chiropractic care to preventatively feel better instead of being reactive, right? And waiting until like we go to the doctor and then at that point trying to come back and do something reactive. It's really important to stay in front of like our optimal health and how we can feel well every single day of our life and not wait until the last minute, right? Or until something pops up in order to be reactive when we could have been proactive for weeks or maybe months or even years, right? Depending on how early we find out about chiropractic care and decide to opt into it. So thank you, thank you, thank you so much. I really, really appreciate your time and your expertise.
Yeah, you're so welcome. It was fun to be here today.
Okay. All right, everybody. So we'll see you guys in the next episode. Bye.